Screen. Hello, everyone, and welcome back to another session with Dental Shadowers. Today, we have an exciting session with Dr. Hyman. Dr. Hyman, thank you so much for joining. And on that note, the floor is yours.
Yeah, so thank you so much. A joy to be with you all this evening, and just welcome young doctors to be. This is one of my favorite things in the world to do, is to spend time with bright young men and women that are looking towards a career in dentistry. I had the privilege of 32 years of private practice in Greensboro, North Carolina, and now I'm an adjunct full professor and a special assistant to the Office of the Dean at the UNC Adams School of Dentistry. So I love these sessions to be informal. I love them to be participatory. There's no right or wrong answer. I just want you to dive on in, throw out your thoughts, put some notes in the chat. You can join me in ganging up on Issa and giving him a hard time if you want, but let's just have a good time, kick back and relax and be yourself. I love this. I had a talk titled Beauties and the Beasts, the Greatest Hits and Misses of Cosmetic Dentistry, because the cases don't always go the way that you wish. I had an organization actually from UAB that wanted me to talk about kind of the cases that kept me up at night. And so that's going to be part of what we talk about as well. I do bring you greetings from North Carolina and from the beautiful city of Chapel Hill. I'm a quadruple Tar Heel gang. I went undergrad, dental school, residency. Now I teach at the dental school. That's the old well. The legend has it, if you drink from the old well the first day of class, you make straight A. So there's a line for miles during the first day of class waiting to get to the old well. UNC is the first state university. It was chartered in 1789, I think. And just a wonderful, wonderful place to go. I hope all of you will consider joining us at the UNC Adams School of Dentistry. We really got it going on. Chapel Hill itself, this was a guy who was in school when I was in dental school. I can't remember his name. It was Michael something. Issa, can you remember?
I have no idea.
You're killing me. You're killing me, Smalls. That's Michael Jordan. So I was a classmate of Michael Jordan's at UNC. If you're a soccer player, you know Mia Hamm. So the greatest basketball player of all time and the greatest women's soccer player were both fellow Tar Heels. And these are a bunch of my students, which I love the privilege of teaching them and getting them up and rocking and having a good time. What's a UNC dental student look like? They come in every size and shape and color and religion and sexuality. We're a family. Families don't always get it right, but it is a wonderful place to learn and study and grow. And I miss being in person with these folks and can't wait. I had my first COVID shot already, so I'm looking forward to getting back with my students in a couple weeks. So Carolina Dentists, I do believe they're best in the world. I love this shirt, particularly because being a Tar Heel, both of these women went to Duke University undergrad. So I love to tweak them that they have to wear a Carolina shirt, but that's kind of cool. So dental shadowing, you can't be in person at my office right now. So imagine that imagine that we're side to side, cheek to cheek, learning and talking and growing and stretching and challenging you to look at cases differently. I'm going to show 5-6 cases that were really head thumpers that really challenged me. The fact is, gang, we see the world differently. Don't you agree? Some of you look at it one way, some of you look at it the other. If you said to me, Dr. Mark, what's it like? What's the future? What's my profession going to be like being a dentist? Man, your future's so bright, you got to wear shades. Being a dentist, it's just the greatest profession in the world. Are there storm clouds, gang? You bet there is. And there's always going to be. And so there's tough times coming. One thing that the profession of dentistry is facing is non-dental people practicing dentistry. I am not here being anti anything. I do have strong opinions that represent my own. For example, a Smile Direct Club, the deal with that is you don't have to be a dentist to walk in to work for CVS Pharmacy that is opening 1,000 dental clinics, Smile Direct clinics, that you walk into a pharmacy and a non-dental person can look at you and make a decision whether you're going to start your orthodontics or not. And so that is what I object to. There's a reason that you all are working so hard that you want to go to dental school. And this is just a whole lot better to me, not orthodontics that moves the teeth out of the bone or impressions that aren't of a quality fashion, but elegantly done orthodontics that are properly planned where you've evaluated the occlusion, how the teeth fit together, the health of the jaw joints, the TMJs. You've done an oral cancer exam, a cavity exam, a periodontal exam, a review of the medical, dental, and history, that you sat down with the patient and you said, what are your goals for your health, your teeth, and your smile? So this is something that's very important to me. If you were shadowing my office, you would see for every single patient, we try to get that established. It's a dear friend of mine, a colleague of mine, Dr. Colin Richmond from Atlanta, a master periodontist, who's showing how some orthodontic cases can go south because the teeth have gotten moved through the bone. So this is why I object to a Smile Direct Club. I'm not bemoaning and putting down anybody's choice of how they choose to practice. But for me, this is what excellence is about in dentistry, is making the proper diagnosis when you're in a relationship with your patients and you help them achieve their goals. So you can see from these radiographs, it may be hard for you to appreciate this yet in your career, but as you look at the radiographs, you can see there's no bone wrapped completely circumferentially around the root. You see the clinical example in the bottom of the slide. The root tooth is basically being pushed out of the bone and into outside the mouth. So that's a tough circumstance. I don't know where everybody on this call is going to be career-wise. Issa, for example, do you know teeth numbers already, bud?
Yeah, I do.
Okay, so basically an adult has how many teeth?
32.
32. So smart. You could be a Carolina dentist, young man. I'm going to teach you first year of dental school in 1 minute. Basically, there's 32 teeth. If you take out the wisdom teeth, then the terminal teeth would be number from the top right. So with wisdom teeth, it's number 1 around to 16. The bottom left wisdom tooth is 17. Around the horn to the bottom right is 32. So the wisdom teeth are 1, 16, 17, 32.
Correct.
So if you're taking out the wisdom teeth, you've got 2, 15, 18, 31. Does that make sense?
Makes sense.
So you're going to start to picture teeth in groups like that. The canine, the eye teeth are 6, 11, 22, 27. It'll just come naturally to you. And there's 5 sides to a tooth. Towards the middle of your mouth is the mesial, where you bite your teeth together. Where you occlude is the occlusal. The most distant back is the distal, the D. Towards your cheek is the facial. Towards your tongue is the lingual. So it's MODFL, 32 teeth. That's first year of dental school. Issa, how'd you do?
That was perfect. But what about buckle? Because I hear that term a lot.
So the facial is a buckle as well.
Okay, so it's just
buckle's kind of old school. So
Okay.
the classic is MODFL or MODBL.
I see.
So Issa, as you're looking at this radiograph, top right 12-year molar is tooth number T2, touching tooth number 3. Can you appreciate that, sir?
I do.
So part of what Dr. Mark wants to always teach you all is anytime you look at a picture, anytime you look at a radiograph, you always go peripheral and then you go for the teeth. If you don't start with the big picture, you're going to lose. He says, you look at that teeth, can you see where the red circle is?
I see it, yeah.
Do you appreciate the dark area underneath the metal?
I do.
Does that appear to be cavity, to be a change going on?
It might be a cavity.
Like the way you're thinking, young man. So the obvious thing when you look at this picture is, yeah, we could refill that, or we could recrown it, or we could take the teeth out, or whatever you want to do. So if I asked you, Issa, for what is optimal care here, but I hope your answer would be is, Dr. Mark, I can't see the whole tooth. I need a better x-ray. And if you were to say that, in fact, when you look at this radiograph, you see the distal, the most distant part of number 2. When you look at the bone along the root, there's almost no bone holding that in. So looking at this case just like this, and I say, Issa, what does this patient need? Your response to me should always be, what do they want? What's appropriate? I don't know because I can't see the entire picture. I can't see where the sinus is. I can't see the bone level. So you guys, you will win in your dental career if you always ask one more question. Does that make sense?
It makes sense. Perfect.
So that's kind of cool going
Always
forward.
asking questions.
And it will hold you in good stead. Another question is, when do you fill a cavity? When do you watch it? When I hear that, Issa, have you shadowed when you've heard a doctor say to a patient, let's watch it?
I haven't actually shadowed a filling.
Not yet.
Not
but
yet,
you
no.
will, and you may hear your doctor look at something and say, well, this might be a cavity. Let's watch it. My answer to that, very humbly, Issa, I don't want you to say this yet, but my answer would be, watch it do what? Watch it grow into the pulp and then they need a root canal?
That's not the best
So that's
scenario.
not optimal. So what the action step for this slide here is, if you work with photography, I'm going to pound that tonight. It's going to change your career. Because a lot of times what you see on the surface is not, in fact, what's going on below. So I want you to use all the good diagnostic tools we have in dentistry and look beneath the surface and think, and always remind yourself, keep going back to the idea, to the question, what is appropriate? What is appropriate for this patient at this time in their life? Does that make sense?
Makes sense. Total sense.
So there is a 4-letter word that I hate in dentistry. Issa, you know which one I'm talking about? Not that one. It's
No idea.
need. You need a crown. You need a filling. The answer is no, they don't. The better 4-letter word is want. What do you want? How healthy do you want to get? How soon do you want to get there? What is appropriate for you at your time in this life? And that's a really cool way to look at healthcare. So you balance the wants and the needs, and you don't judge with people. The fact is, my dear friends, business is nothing but relationships. If the first thing you see a dentist do when you're shadowing is pick up instruments and go right for the teeth, they lose. I had 32 years in private practice, and one of the great gifts that my mentors taught me was how to out-listen the competition. We're going to talk about that more as we go through today. This was the highest producing room in my office. This was a consultation room. Every new patient, every emergency patient came in and they sat down with me. The patient would sit and my treatment coordinator, and we would go through a list of Dr. Mark's 10 questions. So I've had people say to me, Dr. Mark, I'm too busy. I can't sit down and take that time. And I'm saying, you can't afford not to. You have no clue who you're working on. And if you commit to this, young doctors, if you commit to this early in your career, this one slide is the secret to you having success beyond anything you ever dreamed of in your life. So please feel free to screenshot this or take a photo with your iPhone, the next 2 pictures. This is Dr. Mark's way to outlisten the competition. Every patient I worked on was asked these 10 questions before we went and sat him in the operatory. So Issa, I used to say, Issa, imagine you're the new patient. I would say, did you have any trouble finding your way to the office? Because if they said, well, yeah, I'm new to town, it led me to a different type of discussion with Google Maps and
advertisement.
Now it's a little different. So now I would say, Issa, who can I thank for referring you? And if you were to say to me, well, you're part of my PPO, my preferred provider organization, my HMO, health maintenance organization, you have to see me. That's not very preheated versus, Issa, if you're saying to me, well, Alexis went to your office and she said you're the best dentist she's ever been to. I went online, you had 1,200 5-star reviews, so I thought I'd give you a shot. Can you see the difference in that?
Big difference.
You have to see me, or ma'am, or sir, who can I thank for referring you? Which also plants the seed. Issa, if I knock your socks off today, will you tell a special friend about it?
Of course.
So then 5 words that'll change your career, young doctors. Issa, how can I help you? And no matter what the patient says, often they'll say, I hate my smile. I want my teeth whiter. I got a pain in the top right. The temptation in dentistry is you want to get the A, so you want to give them the answer right away. I want you to fight that. No matter what the patient says, when they say, you say, how can I help you? And they answer, you always follow that with, tell me more. I hate my smile. Tell me more. I hate the color, size, and shape. You know which way to go in the conversation.
Why do you hate your smile? Like, you ask them more questions, you're saying.
Absolutely.
Okay.
So Issa, let's role play it. You tell me, Issa, who can I thank for referring you?
Dr. Alexis.
Dr. Alexis, send us the nicest people. They always are so kind. I'm thrilled. Welcome home, bud. We're going to take good care of you. How can I help you, sir?
Well, sir, I think I need a checkup.
Okay, you need a checkup. Tell me more. What does a checkup mean to you?
Maybe I might have a cavity. I might need a filling.
Okay, and if you need a cavity, so how's that going to make you feel, bud?
Healthier.
You would like to get healthier? And I see that you saw a dentist 6 months ago. What did they tell you?
They told me that I might need another checkup in another 6 months.
Okay, so, and obviously you didn't, for some reason you came to see me. Sounds like they didn't knock your socks off. Issa, can I ask you a question, bud? Why now? Why'd you come in today versus next week versus next month? So the answer may be, this is Wednesday, I'm losing my insurance Friday. Or I'm going to a wedding this Friday, I want my teeth whiter. Or I got a hot date on Tinder and I've got dog breath. Whatever it is, if you ask these questions, gang, Issa, can you see how you peel the onion here?
You start to understand your patient more.
Yeah, and the patient's going to lead you Instead of you telling him you need to whiten, you need to floss, you need your teeth cleaned, you need a filling, the patient's going to say, I want this. So why now? What's the time frame? He said, what are your long-term goals for your health, your teeth, and your smile? I'll say, I'm not trying to be smart with you, bud. Is it important that you keep your teeth the rest of your life?
I mean, for me, I think it's most important to keep a very healthy lifestyle, and
Beautiful.
my
We
teeth
can do
includes
that for
that.
you. He said, if I may ask you, you're a handsome young man. Who else has input here? Do you make your own health decisions? For me, my wife is a nurse. For my wife and my 3 kids, all the healthcare decisions go through my wife. So I just want to make sure you're presenting treatment to the decision maker. Does that make sense?
Makes sense.
Do you have a budget in mind? Issa, you may come to me and say, man, I want a gorgeous white smile. I got $500. I'll say, well, here's a tube of day white, night white, and here's a Sonicare toothbrush. Good luck, because that's about all you can buy. Swear to God, gang, I had a patient look me in the eye and said, Dr. Mark, money's kind of tight. I only have $30,000 or $40,000 to spend on this. He said, what do you think I said?
That's
I
more
went
than
right to the
enough.
bottom. We can do that. How soon would you like to be finished? So does that make sense? I
Makes
promise
perfect
you, if you
sense.
take the time to ask these 10 questions, you will be successful beyond anything you ever dreamed of. Now, my coaches and hero in dentistry were Jameson Management out of Oklahoma, and I did a webinar for Jameson Management. Please screenshot this or write this down if you would, friends. And this was on Facebook, so it must be true, right? But I said, when I stopped telling people what they needed and started listening to what they wanted, everything changed. Does that speak to you, friends? When I stopped telling my patients what they needed, you need a crown because I said so. And I started listening to what they wanted. He said, how healthy you want to get, how soon you want to get there.
That goes back to the questions that you asked in the previous slide.
It transformed my career. So that was kind of cool. Now, you may see a dentist draw a tooth for a patient chairside, which is what we did back in 1492 when I started dental school. Is there anything better that we have? My coach, hero, and mentor, this is Dr. Kathy Jameson from Oklahoma. I hope each and every one of you include Dr. Jameson in your career. She's an absolute brilliant superstar. Kathy said these 8 magic words that changed my life. She said, Mark, how do you create the sense of urgency? Monday morning, 8 a.m. with your patients, how do you create the sense of urgency, the sense that you have something important to say? So I am not here hawking product. Anything I show you, young doctors, I buy myself. This is the number one piece of equipment I want for every one of you to buy. If any of you are in dental school already, it's worth buying an intraoral video camera. DigiDoc is an American company. That is the private cell phone number of the president of the company. So you tell them you're a student of Dr. Marks and you want some love, but this is the number one thing I can offer to you, gang. He says, I show you this, and I say, he said, imagine you've examined me. I'm your 8 o'clock patient Monday morning.
Mm-hmm.
What are you going to tell me I need?
Is that a filling? If I can
It
see
looks
it.
like a filling.
Yeah.
You can hardly tell what it is.
Yeah.
Am I right?
Yeah, I can't really see it.
Because it's this little stinking nothing. Or you hand the patient a hand mirror and say, can you see the distal facial in number 2? At my age, I can't see past the front 6 teeth. Or he's picking lunch out of his beard. So this is the same tooth, Issa.
Wow.
Tell me what you see, the most distant back, the distal. Do you see that line going through?
Yeah, I do.
So what would you say to the patient?
I'm not exactly sure.
So ask a question. Do you know what that is?
I know that's a filling.
So you see the filling, you see the white is the enamel, you see the filling. I'm not putting you on the spot, bud, and you're doing beautifully. But as you go around the horn here, you see a lot of dramatic changes happening, don't you?
I do.
Going right out the distal, the most superior part of that picture. You see that brown line going through the enamel?
Yep.
That's a crack.
Crack in the tooth.
That is a crack in the tooth. So the great joy to me is not you tell the patient that they have a crack, is you show them that and say, do you know what that is? They may say, I don't know. You'll say, what do you think it is? They'll say, is that a crack? Yes, it is. How can I help you?
Wow.
And that's when
That's the
it's
best way to do
supper
it.
time. That's when it's victory, because now they own the problem. So that's kind of cool. So as bright and talented as this group is, I guarantee you there isn't a one of you that has the verbal skills to treatment plan, diagnose, close, sell, however, whatever word you want to use with this. It's going to be hard for you to get a patient to accept treatment using that tiny little picture that I first showed. But using a color photo that fills the whole screen, can you see the difference?
Absolutely. You can show the patient what he needs. And what
Exactly.
treatment.
Issa, I had 8 operatories in my private practice. How many cameras do you think I had?
Plenty.
Try me. How many cameras do you think I had? 8 operatories.
10 maybe?
I like the way you think. I had one in every operatory and one in the bathroom too. No, I'm kidding. 8 operatories, 8 cameras. Issa, who'd I use the camera on?
The patients.
Every patient, every procedure, before, during, and after. If I don't teach you all anything else tonight, that is the single signature thing that will change your career. That's one of my superstar hygienists, Lauren. People say to me, Dr. Mark, I can't get my hygienist to use the camera. The simple agreement that Lauren and I had is if you don't have a picture before I come in, I'm going to walk back out of the operatory until you take a picture. We all are visual learners. So this is a cool way to work. This was another one of my superstar treatment coordinator, hygienist Laney. Just was texting her before the webinar started. So we took SLR photos as well, but we had intro cameras chair side. We would sit down and game plan this. This is a treatment coordinator, lead dental assistant, and one of my specialists. We would huddle, we would meet, we would communicate every morning in the practice. If you were shadowing in my office every morning at 7:40 sharp, the entire team would huddle up and we would plan who's doing what for the day, who's in what room when, where there are challenges to the schedules, where there's opportunities to augment treatment. And so this was a great way to work. I had an amazing team in my practice career. Issa, I had a receptionist was with me 25 years, my lead dental assistant 19 years, 3 of my hygienists 15 years. Just as a hint, young doctors, the average dental assistant stays with a practice 10 months.
Wow. So it's a whole family.
Decades. It was like a family. And I trained them and got out of their way and let them dance. So that was a lot of fun. This is my superstar assistant, Athena Escovedo Calloway, who I worked for 19 years. Here she is programming a CAD CAM restoration. Can you see the during photo that's up for the patient?
Is that the one that she's using?
Absolutely. That is the during photo. When I took off the old crown, the patient could see how much cavity he had.
Wow.
And then the next picture he's going to see is when Tina's finished and we've cemented it. And I show him the before, during, and after printed out. That becomes my business card. He takes it back to work with him. It's an unbelievable opportunity. So let's look at some cases that were kind of difficult. For me, gang, I'm not trying to be your daddy here. I want you to achieve your dreams. So what do you want to do in your life? What type of care do you want to deliver to patients? For me, my great joy was to have a fellow human being come to see me. Issa, first gut impression, what do you think of this smile?
Not the most optimal, but
seeing a lot of changes, don't you?
Right.
This is a woman who'd gone through a horrible divorce. Teeth had just crumbled. She was ashamed of herself. She's
grinding,
got old.
Maybe some grinding.
Very, very good young man. You see flattening of the lower anterior teeth. You see cavity along the gum line of many of the teeth. She has veneers on the front 2 teeth that don't really look aesthetic anymore. And this is when my treatment coordinator said, give me a smile. What I wish and hope and pray that I can help model for you all is the joy of our type of dentistry when you lay your hands on these patients that give us the privilege of caring from them and you blink.
Wow.
How many of you would like to do care like that? How many of you would
That's
like
the
to
best care you
deliver
can
this
do.
type of care and put someone's smile back in their heart and back on their face and back into their life? So that's what I wanted to do career-wise, and it was a whole lot of fun. We had a high-end aesthetic-oriented dental practice. This was us marketing at a bridal show, which was pretty target-rich. The young man who bought my practice, do you look at the difference in this marketing here? Does this look like the same message?
Completely different.
Now hear me crystal clearly, gang. This is not one is good and the other is bad. But the young man who bought my practice knew who he was segmenting for. He wanted to target men and women who hadn't been to the dentist in 10 to 15 years and were scared to death. He would knock them out with IV sedation, and do 10 years worth of dentistry in one sitting. So you just have to know who you want to serve. How are we going to show people what's possible in our practices? If you were shadowing in my office, you would see some of the simulations that we would do. This is Preview, PRE-VU. It was started by a hygienist, where you can, in about 30 seconds, you get a good before photo, kind of Photoshop it, and before the patient is even finished getting a Panorex, a full face x-ray taken, they can be seated in the operatory, and you put this picture in front of them and say, how can I help you?
Wow.
Isa, would that be kind of fun?
That would be amazing. You can show them exactly what they're getting and how exactly you can help them.
It's a wonderful way to show possibilities. For you young doctors in your career, you'll be amazed how dentistry is going to continue to explode and grow. Where traditionally somebody had just a denture that would come in and out, now you can place 4 implants and place restorative, what is called an all-on-4, and it's like them growing a new set of teeth. It's really amazing. For your high-end aesthetic cosmetic dentistry, instead of just doing a traditional dental wax-up, you can do imaging, photoshopping, you can do digital smile design, where you can have the computer show you exactly how much tooth to take away from which tooth in what spot. And you can show the patient a simulation what they'll look like when you're done. Just for your information, plant these seeds, young doctors. The Pankey Institute in Key Biscayne, Florida is where I studied and taught the Institute for Advanced Dental Education. If you haven't had a chance to visit Pankey or go on their website, please do so. Spear Education in Scottsdale, Arizona is another unbelievable organization. And for me, my time inside of dentistry at Pankey changed my life. Outside of dentistry, my involvement with the Dale Carnegie organization. If I interview you at UNC Adams School of Dentistry and you tell me that you've read How to Win Friends and Influence People by Dale Carnegie, man, you're going to have a leg up on the other students. That's Mr. Nigel Alston, my dear friend, Carnegie coach, hero, and mentor. Every woman in my team took a level of Dale Carnegie training. Now, Isa, that costs about $1,000 some to train the team. Does that make sense to train the entire team? Isn't that a lot of money?
I mean, it's worth it in the long run.
Like the way you're thinking. People have said to me, Dr. Mark, that's nuts. What if you pay for Dale Carnegie training and then they leave? And the answer is, what if you don't pay for Dale Carnegie and they stay?
Then you just got one
So
hell of
you've
a
got
deal.
low performing teammates instead, or high performing, high achieving, turned on, fired up teammates. So Isa, why do these women stay with me 15, 20, 25 years?
You
I
build
loved on them. I
the
appreciated them. I honored them.
it's that relationship you build with them that's most
Like the way
important.
you're thinking. It's absolutely. So this is Jameson Management, Carrie and Jess Weber, center and right, and on the left with the blue cami and the pearls is Miss Amy Parrish, Amy Logan Parrish. They are the leadership of Jameson Management now. Dear wonderful friends, take a screenshot of this. This is complimentary for some webinars for you. If you go on jmsn.com/Hyman, you get some complimentary webinars. Please screenshot that and consider doing that for me. For the rest of you young doctors as well, this is ACT University, which was the COVID relief conference that turned into ACT University. If you use this code, www.actdental.com/A/27418 YCYO8CUN. That's my private code. Normally it would cost $2,000 a year to join ACT University. As long as you are a student, you put down that you're a student of Dr. Mark's, and you get complimentary. There's like $1 million of videos on ACT University. All of my students at UNC go on this and watch these videos. I've got about 11 videos on here. Kind of crazy not to do it, okay?
And what exactly do these lectures entail?
Everything in dentistry: restorative, treatment planning, diagnosis, digital smile design, dental hygiene, everything you can imagine. These are some of my best friends in dentistry, and just I look through the list here. It's just you can't imagine the benefit of this. It's simply unbelievable.
It's amazing.
So Isa, can you read this for me, please, doctor?
Don't be afraid to give up the good to go for the great.
Does that make
John
sense?
Mark. Of
I
course.
want you fired up. You're shadowing with me. So let's look at some patients. So this woman is a professor at the local university, comes to see me, has just fired her local dentist, who said to her, what, Issa, the two front teeth are teeth number, see how good you are, Doc.
6, 8, 9.
I like the way you're thinking, 8 and 9, the two right and left central incisors, number 8, number 9. She has just fired her dentist, who looked at her and said, you need to crown your front teeth. You need to bond your white teeth. You need to whiten those front teeth. Issa, what does she need? Nothing.
No, not really. No.
So the woman looked at me, this professor said, Dr. Mark, is there any dental reason to fix these front teeth? What's the answer?
No. As long
No,
as you
they're
can
just ugly,
buy,
but you can't say that.
you can't
Now,
say that.
gang,
No.
I could show you all sorts of books. How to get to yes, the power of positive no, questions are the answers, on and on and on. The single best thing I can teach you instead of how to sell is how to listen. And without judgment, guide a patient through health. She had no interest in changing her front teeth, but she had big mercury fillings on her back molar teeth. And she said, can you fix them in gold? What's the answer?
No.
We can do that. You can have them in gold or white. Which do you prefer? Now, this was back 20 years ago, Issa. Back then, I would say gold was the best material in dentistry. Now, the ceramics we have in 2021 are so unbelievable. You can get a ceramic restoration to last as long as gold.
Wow.
So, Issa, yes or no, was that a success with this woman?
Of course it is. Whatever is the most optimal and healthy option for the woman.
I like the way you're thinking. Does that make sense?
Indeed it
Issa, have
does.
you ever had a dentist talk to you like this?
Never.
So you outlisten the competition, you give the patient what is appropriate for them at this time in their life. The fact is, young doctors, then there's no competition. If you practice like this, virtually everybody says yes to you because you keep asking questions till you get them to identify what's important to them. This is Justin. Handsome young man, nice beard, about 6'8", scares me. This big mountain of a man walks in. It's my next wife. Yeah, right. That's Angelina. The golden proportion, the golden proportionality. Angelina and Brad Pitt both have the Greek, Roman god, goddess, perfect proportionality. If you look at the Michelangelo, Leonardo da Vinci, they worked off of the golden proportion, which is your central incisors are a proportionality, mesial distal, going across of 1.6 to the laterals 1.0 to the mesial half of the canine 0.6. You see how the canines curve around the arch? He says you look at a smile, it's not like a square, is it?
No, it curves.
It's like a U shape, it's like a curve. So that is the golden proportion that goes back thousands of years for ancient beauty. So if you look at this and you look at everybody's smile for the rest of your career, young doctors, you superimpose the golden proportionality over a smile and you say, does it fit, yes or no? You look at this young man's smile. Issa, look at the golden proportion again. Does it fit?
Absolutely not.
It does not. So you start drawing lines, roughly your canines, number 6 and 11, their gum line should be at the same level as 8 and 9. The incisal edge, the biting edge of 6 and 7 should be the same length as 8 and 9. Your lateral incisors, number 7 and 10, should be a little shorter. Does his smile violate the golden proportion?
Yes, it does.
All over the place.
Everywhere, yeah.
As you look at that, you look at the length of the canine teeth, just completely off. So what's happened to this young man? Chief concern, why'd you come in to see me today? Said, well, I think I got some problems. Now, it's what we describe this, gang, when the front teeth don't touch, we call this an anterior open bite. So what's the etiology? What is the cause of an anterior open bite? Sometimes it can be a tongue thrust. You look at the top right photo with the tongue stuck forward. Sometimes for TMJ, the jaw joint, the temporomandibular joint pathology, dentists will make an anterior deprogrammer, an anterior splint that only fits on the front 6 teeth. If you wear it too long, your posterior teeth can super erupt. Does this make sense? Generally, teeth grow in until they hit something. An open bite can be caused by a tongue thrust, by a splint, by a thumb sucking habit, somebody maybe sucking on 2 fingers. Issa, top left photo. Do you play hoops, young man?
I do not. I play soccer.
Not yet. May not get you at Carolina. We have wicked intramural sports. We always have to whip the med school in sports. But this is what happened to this young man. He was playing hoops and he got an elbow to the chops. So do you see the 2 vertical lines here?
Yes, I do.
Do you know what those are?
The root?
The roots have had root canal fillings done. Now, this is a high-level case here, gang. But the challenge, when you look at the remaining tooth structure, Issa, can you see how when X-ray is light, it is radio opaque. When it's dark, it's a radiolucency.
Got it.
So radio opacity, a radio opaque is the more whiter areas. So that root canal filling, that is the gutta percha, G-U-T-T-A. Gutta percha, it's the same material like was used in golf balls. But if you look at his roots, they're being dissolved away from that trauma. Now he's got what's called resorption. So this young man says, Dr. Mark, I think I have a problem. The answer is you're about to lose your front teeth. So this was a tough situation. So his teeth are resorbing, dissolving themselves. So you're gonna have to take out the 2 front teeth. He's gonna heal up, bone graft, and get some dental implants done. That should be the end of the story, Issa, right?
I hope so.
In fact, I always met with my specialist when I had dental implants placed, always, 99.999% of the time. This is the time I didn't meet with my specialist. The implants are placed. Issa, do you see a problem? Look at the line where the canines are. Where's the crest of the tissues? Where's the central incisors gum line supposed to be?
It's not aligning.
Equal with the canines. Are those going to be equal? I look at where those implants are placed. I'm like, oh my God, I'm dead meat here. Because the surgeon put the implants where the bone was. You see the 3rd arrow just shows some cavity there. So this is one way to solve the problem is you put some pink ceramic there. I look at that and I go, man, that looks ugly. But that's closer to the proportion of what you were shooting for. And here's where I got away with it, because that's his full smile. So it didn't really matter that I put in these dinosaur teeth in him. And I got the thumbs up, so that's a good thing. First impression, Issa, is this guy just bad to the bone? He's got the leather jacket. He's got the shades on. He's got the hat.
He looks good. He looks good.
This is Steve. He's a good-looking man. Thing is, I saw him in 1986, and then I didn't see him again for like 14 years. I'm like, Steve, where you been?
Oh, my God.
Turns out he has roaring cancer, radiation, chemotherapy, surgery. His body is crumbling.
So he needs an obturator, I'm assuming.
You know, a good thought and a good question. His teeth have rotted. He hasn't had the surgery in his mouth. He's had the radiation. And he's still intact enough to not need a palatal obturator. But he's got 1, 2, 3, 4, 5, 6, 7, 8 teeth left. About the ugliest smile I've ever seen. So how do you decide what's next? You can almost treatment plan anybody you see, young doctors. If you look at these 8, you may take a screenshot of this if you like, or photo this. So how do you decide what's your treatment plan? One choice is always do nothing. Number 2 is to watch everything. That's not a good plan. Number 3, you get the gum stable. Do you crown lengthen? Do you take away gum or do you graft it to add it? Number 4, do you get a pre-denial from the insurance companies? No, that was a trick question. Number 5, is there an orthodontic component? Yes or no? Traditional orthodontics or Invisalign? Do we lighten the teeth, whiten the teeth? Do we do some sort of white fillings? Do you do veneers on the fronts of the teeth, full crowns? Do you pull everything out and do implants? No. Or do you refer it? So you can almost break any case down to saying, go through each specialty, what's appropriate, you crunch it all together. So for him, he's had the radiation, he's had the chemotherapy. This is 21 years ago. He did not want dental implants, and he's pretty miserable.
I have a question.
Yes, sir.
When you get chemo, since your bone and tissue start to get damaged, is it optimal to go through an implant or
Brilliant, brilliant question, Isa. So if a patient has had head and neck radiation, you almost cannot do any more surgery.
okay?
If a patient, because of osteoporosis or chemotherapy for another cancer, if they've had the bisphosphonate medications, you really can't do the dental implants or you run the risk of osteonecrosis, the remaining bone crumbling. So this is why you work so hard in dental school to master your pharmacology, physiology, anatomy. And at UNC particularly, we stress you work with the School of Pharmacy, the School of Medicine, the nursing school, the public health school, because we are trying to train you all to do intra and interprofessional knowledge. So you look at this, Isa, first glance, that's a pretty good result, isn't it?
Of course it is.
I mean,
Much better than before.
from this to that. Now, if you count teeth with me, so on the bottom right, the molar tooth that's sticking out, that's tooth
It's
number 3.
missing.
Can you count with me? Just go up 3,
3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14.
3, 4, 5, 6, 7, 8, 9, 9, 10, 11, 12, 13. I put 3 central incisors in there to close that honking space. If you count these existing teeth that he has tooth number 4, 5, 6, 7, 8, 10, 11, 12. He's only missing 1 tooth. So this is a really tough case. Cancer, radiation, chemo, hadn't seen him in a long time. This was the best way, instead of putting 2 big chiclets in there, to put 3 front teeth. Here's the case tried in. How's he look?
He's happy.
And he goes home and shows his wife, Issa, and she says, I hate him. I'm like, you kidding me? He comes back and says, my wife hates him. I'm like, are you kidding me? She was kissing those nasty dogs. Anyway, he said they were acceptable. There's a 2-year follow-up. And then he passed away.
Oh, no.
And I presented this case at the UNC Adams School of Dentistry years ago, and a young whippersnapper got in my face and said, are you trying to tell me you did all this work on someone that was about to die? What's the answer? He said, if you walk into a Lexus dealership and say, I've got cancer, I want to buy a Lexus, what are they going to say to you? Oh, no, no, no.
They're going to sell you that Lexus.
Go buy a Volkswagen.
You're going to make sure he has the best 2 years of his life.
That's exactly it. If I can inspire you, young doctors, to treat every patient you work on with the very finest dentistry you have to offer, you'll be amazed how many people will say yes. 20 years from now, my dear friends, you will be more disappointed by the things that you didn't do than by the ones that you did. So take the chance to care for people. This is a workman's comp case where a patient of mine tripped on a wet mop was working at a pancake house in IHOP, cracks her front teeth. So this is Rosie. Look at the hair, look at the dress, the earrings, the whole affect. That kind of reminds you of Rosie the Riveter. Have you all seen that before?
I feel like I've
like
seen
World
it.
War II, but
Yeah.
that's Rosie the Riveter who joined the workforce. So here's Rosie. She's fallen. She's cracked her front teeth at work. Workman's comp means workman's comp insurance is paying for the care. I hated workman's comp cases because it often took you a year to get paid, and you had to go through all of these paperwork. But this was a tough situation. But you look at Rosie, she's nailed number 7, her lateral incisor, number 8, number 9. Look at the crack towards the gum line at number 9, number 10. Number 11 is receded there. That wasn't from the accident. So what do we do here? You appreciate the right side, the left side. So first thing I did is send her to my endodontist. She needed 4 root canals because those teeth were crushed and the nerves exposed. She's got her safety glasses on. This is an Isolite, which is a 5-in-1 bite block, tongue retractor, cheek retractor, suction, LED light. Every student at the UNC Adams School of Dentistry has the privilege of working with an Isolite and an intraoral camera. Two projects of mine, which I appreciate. This is beyond your scope right now, but I always try to teach my students to use as many lights as you can. If you're curing multiple teeth, it cuts the time it takes you to cure. We'll talk about that at another time, perhaps. So here's your before. Issa, what do you think, bud?
Amazing.
Would you like to do dentistry like that?
Of course, that's the best.
And you turn this face
turn into a smile.
Into that. And Rosie's walking out, and I'm like, oh, you are kidding me. Stop. Wait a minute. Let me get my camera. You do not have a bag with Rosie on it. And she did, and I love it. And she is a beautiful woman. And I got to put the smile back on Rosie's face. End of story, right? If you're my students at UNC, you know the answer is it's never the end of the story. Issa, where did I screw up?
I have no idea.
What did Dr. Mark miss?
I wish I knew what that was.
So what that is, it's called a fistula. It's where pus is draining out of there. Rosie, when she fell and crushed those front teeth, I don't know how I missed this. If it didn't get written down when I did the initial exam, if I got so excited about Rosie being Rosie the Riveter and taking the photos, saying, this is a great seminar case. So number 6, the upper right canine tooth was vertically split and I missed it. So now I got to go back to the insurance company and try to get them to approve getting the tooth pulled and a bone graft and an implant. But there's Rosie, the final time, and she's got a gorgeous smile. And I love, in our practice, I don't want this to be creepy to anybody. We're a very huggy, hands-on office. We would take a picture with the doctor when we were finished and the lead dental assistant that walked the patient through the entire case. So that was kind of cool. Can you read that for me there, Issa?
When you make a bad decision, it doesn't make you a bad person.
Does that make sense?
Of course.
If you stub your toe, say so, and you make it right. So the difference of failure and success going forward. Could you read this, Issa, one more for me?
Someone has stretched beyond the comfort zone, tried something new, screwed it up, and learned something valuable along the way.
That is the difference of success and failure, is not being afraid to get out of your comfort zone and say, I'm willing to try it. If I screw it up, I'll make it right. And that's okay. This is Karen, hair, clothing, makeup, affect. Issa, any interest in optimal care dentistry?
Of course. I mean,
probably not, right? Look at that face. She doesn't look like she cares.
No, she doesn't, no.
Unless you ask. How do you know if you don't ask? Now, this is a highly advanced case for you young doctors, but stick with me here. Tell me what's catching your eye as you look around. As you look at the gum line, Issa, tell me what you're seeing, bud.
Receding. It looks like, I think she has implants or crowns.
So she's got full crowns, upper and lower. If you look at the gum line, you look at the recession, look at the vertical cracking of the ceramic on tooth number 22, how the gum is receded, there's cavity underneath it, the pink porcelain trying to hide how much recession she had there. The gum line on the bottom right. The case is a train wreck, isn't it?
Is this an issue with the material used?
A brilliant question. We'll get into that. Issa, do you agree this looks bad?
Of course it does.
You look at the right side, you see all the gum exposure. You look at the left side. One of the hardest things that this is way advanced concept, but you all are smart. Roughly, when you look at the top teeth and the bottom teeth, you want them to be like two flat surfaces going as the lower jaw moves forward and side to side. You don't want any interference. So you basically want the length of those front teeth the same and the length of the bottom teeth the same. So as these slide, look at the bite here on the bottom left. Does that look correct as you look to have a flat plane going across?
No.
It looks like whoever did this was a fool, right?
Of course.
I mean, I looked at this, I'm like, man, how old is this? She said, 1989. I said, who did this stupid treatment? This was my first full mouth rehab. I started in private practice in 1986. In 1989, Karen came to see me and she let me do her full upper. And I was a dancing bear. I was like, I'm the man, I'm the cheese. I was so excited. I got to do a full upper rehab, third year in private practice. A couple months went by, she let me do the bottom. So that is a 29-year follow-up. Issa, how did I feel when I looked at this case?
Not too happy.
Anybody been there before licking the pig? I mean, I felt like such a fool. And the thing is, except it only lasted 29 years. Most of you aren't even 29 years old. If a patient gives you a hard time about how long your work lasts, how old is your car? Oh, I get a new car every 3 years. Yeah, but your dental work, 24/7, saliva, bacteria, hot coffee, cold ice cream, sugar sodas. So this is, again, it's a complicated procedure to take off the old dentistry. 29 years later, you see how much leakage had gone on underneath it. Again, this is a very high-end case, but basically, with my time at the Pankey Institute, with my time studying at Spear Education, with all the continuing education that I did, if I get the privilege of mentoring and teaching you, I'm going to show you how to take a case like this and turn it into that. Does that look a little bit better?
A lot better. Before
So
she
that's
didn't even
kind of
smile.
cool. My dear friends, sometimes we're tested not to show our weaknesses, but to discover our strengths. I wish you all an absolutely glorious, joyful dental career. I want you to dare to be strong and courageous. That is the road. Venture anything. This is when dentistry is a whole lot of fun. This is the last clinical-ish photo I'm going to show you. I've got about 2 more minutes, and then we'll go for some Q&A. If you look at the top right photo, the guy with the checkered shirt, he's a university professor. The woman is a bank teller. Next woman's a nurse. Next one's the ex-wife of a private eye. Top right photo, African-American man, was my best friend from 9th grade. I went to dental school. He went to the NBA. The next row from the right side, college professor, dog trainer, businessman, clerk at a store. Bottom right is a postman, one of my best friends who makes t-shirts, homemaker, nurse. And then the 2 gray-haired folks in the bottom right are university professors. What's the common thread, common theme of these patients?
They're all happy, and they're all different types of people from different types of backgrounds.
Appreciate that, Issa. How long do you think each of them have been a patient of mine?
A very long time.
This is what I want for you all, young doctors, is someday every patient in this photo was a patient of mine 30 years or more. And so I started taking selfies when I left private practice to join the faculty at UNC Adams School of Dentistry. I just started taking selfies with some of my favorite patients, and I started looking through them one day and I went, oh my God, 30 years, 31 years, 32 years, 30 years, 31, 30. And I just put this little collage together to show you what's possible. And this is what our type of dentistry, if this speaks to you, young doctors, this is what you could have. And it could be a joy. It could be a joy to be part of people's lives like this, to make an impact in their life. I can tell you, dentistry is the greatest profession in the world. And this is work worth doing. And would you agree with me that these are 2 of the most gorgeous children you've ever seen before in your life? Issa, do you have kids?
Well, one day, hopefully.
That you know of? This is my son Samuel, my daughter Danielle Rose, my brown-eyed girl. You blink one more time. There's a third. There's Evie Michelle. She looks more like Issa than me. Thanks a lot, bud. But you blink one more time. I'm at the beach right now with my family and their significant others. What's kind of cool about that shot, the place behind us is where we used to stay when the kids were in diapers. And we came back to the same place for about 13 years, and we haven't been there as a family. My son was probably 13 when we last stayed there, and now he's 31. So I look at these pictures, gang. It's not too late, but it's later than you think, because you're going to blink and your career will be,
Flies by.
it'll fly by. And I want you to be intentional about your relationships. I want you to be intentional about who your role models are. And I want you to aim high, because this is just an absolute joy to do this type of work. I hope this is what you all were looking for today. This is my speaking website, www.drmarkspeaks.com. You can email me through that, or my email is drmark@drmarkspeaks, and that's my private cell phone number. If I can help any of you in any fashion, if any of you are interested in applying to the UNC Adams School of Dentistry, man, we would love to have men and women who are turned on and fired up. The faculty at UNC is just on fire. There are many, many wonderful schools throughout the United States. Right now, if you believe the national rankings, the UNC and Michigan are the top 2 ranked dental schools in the world. And I'm just proud to be a Tar Heel and be part of the faculty. We are a school that is a family. It is diverse and inclusive. We've got men and women of all colors, size, shapes, religions, sexualities. It makes everybody's part of the Carolina family. We got something really special. The incoming class that we have starting in next August is absolutely going to be outrageous. We've got National Player of the Year athletes. We have D2 soccer champions. We have world-class cellists. And we have men and women that didn't speak English till they were teenagers.
Wow.
We got people from every walk of life, and I just can't wait to get a hold of these folks and teach them. So it's been an absolute joy being with you all. So please, who has the first question?
Dr. Hyman, it was an honor having you. Thank
I
you
hope
so
that's
much.
what you all were looking for. How many folks are on right now?
I'm not exactly
I
sure.
think we have 176 people.
Oh my goodness. Is there a chance for me to see who's on with me right now?
Yeah, you can go if you want to check out our YouTube channel.
So I have to just go on YouTube to see who's on it.
Yeah, you could.
So please, from the chat, who's got the first question, please.
So someone asked, when and how did you know that dentistry was for you?
Question is, how did I know when?
When and how did you know that dentistry was for you?
How did I know? Appreciate that. For me, I was a Boy Scout. I don't know how many Eagle Boy Scouts we have on the call. I enjoyed the healthcare section, and my best friend's dad was a physician and was a jerk and chain smoked and yelled at us. So that was my physician role model. And in high school, I got my wisdom teeth pulled by Dr. Steve Hyman, who was not my relative, but he went to Chapel Hill. He had all these cool young people working for him, running around. And there were all these instruments that looked neat. And it's the first time I had laughing gas. So I'm outing myself, but it's the first time I was stoned. I am stoned out of my mind, looking around going, I could be Dr. Hyman from Chapel Hill. So I started shadowing offices, and the physician people that I'd met throughout my life were kind of cold and rushed. And the dental people just seemed kind of cool, and they were doing really neat things. And I was intrigued by the instruments. And so role models became a big thing for me. I worked as an undergraduate student at UNC with the Cleft Palate Clinic, our craniofacial center. And I worked in the hospital dental clinic with hemophiliacs, cancer patients, liver transplants, everything you could imagine. So I got a lot of wonderful experiences shadowing offices, and each different segment seemed just really cool to me. I wanted to use my hands. I wanted to be in a profession, and I wanted to make a difference in people's lives. And in my mind, as a young person, I didn't know how I could handle life and death situations that some physicians deal with. Then it turns out I did a 2-year hospital residency working with the cancer patients, hemophiliacs, transplants, was involved in several codes. Turned out I could have hung with it, but I got very lucky. So my role models were my biggest thing. Who's got the next question, please?
The next question is, how do you prevent leakage with crowns?
Question is, how do you prevent leakage with crowns? The fact is, every crown that's ever been placed is open. It's scientifically a small amount. So the optimal amount, even a well-fitting crown, is going to be 20 to 40 microns. The margin is going to be open. Okay, a human hair is like 10 microns thick. And so almost everything is going to be a proportion of open, because if it completely fits like cellophane on something, there's no room for the cement. So you want to minimize the opening. You get the best cement you can. You hopefully patients have the best hygiene. But the fact is, every crown that I've taken off that's 20 plus years old, every old mercury silver filling that I've taken out that's 20, 30 years old, there's a form of leakage there. It is just a fact of dentistry. Nothing that we do lasts forever. It's a great question. Next question, please.
Interesting. So what do you think of DDS MBA programs?
So at UNC, Adams School of Dentistry, we now have partnered with the Keenan Flagler Business School. So our students have the option of getting a DDS and an MBA, a DDS and a Master's in Public Health. We have a DDS PhD program as well. So I think in today's world, if you said to me, Dr. Mark, I'm not interested in business, I don't want to learn a thing about it, you're setting yourself up for a very difficult situation. 2 years ago, our dean seated practice readiness committee where he took the most successful dentists from Greensboro, Charlotte, Raleigh, Asheville, Asheboro, Wilmington, throughout North Carolina and parts of Virginia, and put us, and humbly, I was the Greensboro person. He put us all in a room and said, how'd you do it? How'd you hire? How'd you fire? What books did you read? What coaches did you work with? What consultants? How'd you make purchasing decisions? And so we have a 4-year practice readiness curriculum at UNC, where basically when you finish Carolina, you know how to read a profit and loss statement. You know how to read an associate's contract. You know about basic investing principles, 401ks, how to hire, how to fire, statute of limitations, covenants not to compete. How do you set your fees? How do you deal with insurance companies? So every semester at dental school at UNC, you get some business training. So otherwise, I didn't get any business training, and I made some really horrible decisions, and I got mad. So I pushed myself and I took a ton of classes and I hired a lot of consultants and I got really good at it. So very humbly, our private practice at the end of my career would have rated as one of the top 1% practices in the United States in production, collection, overhead control, team retention, and fun. So we were very, very fortunate. I hired extraordinary teammates, trained them up, and got out of their way, and they just crushed it for me. I didn't always get it right, but I was very fortunate. So if I get the privilege of mentoring some of you, teaching some of you, by the time we're done, you're going to have a really solid business background to start making long-term decisions to guarantee that you and your family are going to be secure.
That's great advice. For
Next question, please.
For new dentists who are just graduating, how do you recommend that they build clientele?
Super. So you guys tell me, what do you think about offering a lot of 2-for-1 coupons and a lot of free stuff and trying to be the cheapest, lowest cost provider in your town? What do you think?
Sounds like you're hurting yourself in the profession.
You will never win a race to the bottom, gang. So I would rather you see fewer people and stress the relationship time, particularly early in your career. You're going to have some more time, perhaps. So to take the time to go through Dr. Mark's 10 questions, my exit question when I left the consult, the new patient experience, I asked every new patient, I say, can I ask you a question? Issa, can I ask you a question?
Of course.
Have you ever had a dentist start a visit like this?
Never.
So what do you think I heard 99.999% of the time from my new patients?
That was the best experience I had.
I have never had a doctor sit down and talk to me like this. No one's ever asked me these questions. No one's ever tried to get to know me. So the fact is, young doctors, I already got the yes. Patient said yes to me and I haven't even examined them. Can you fathom that? They've already said yes to me. And I don't even know what I'm going to ask them to say yes to, but they said yes to me personally. So I would sit down, do a thorough exam with the intro camera. We'd go tooth to tooth. I'd always start with something healthy. Then I'd show them a change and I wouldn't judge. And if there was a couple teeth in a row and they go, oh my God, my mouth's terrible. I'm like, no, it's not. You got a bunch of great teeth. Yeah, you got some changes going on. We'll figure it out. You tell me how healthy you want to get, how soon you want to get there. I'll get you there. Someone had 8 teeth to fill. Issa, I'd say, Issa, you're a handsome young man. I know you're busy.
That's
You
all
want to
you.
come in 8 times, 6 times, 4 times, twice? Would you like to sit down one time? We put on some noise reduction headphones, crank out some tunes, pop
And
on nitrous, let you catch a buzz, bam, get them all done. You don't have to come back and see me. It's a wonderful way to work, gang. So people almost always said yes to me because I kept saying, Issa, you're busy. You want to come back 8 times or once?
once.
So that's not a yes or no question. It's a choice of 2 yeses. That's another thing that I'll work with you all on. If I get the privilege of having you as Tar Heel dentists. Next question, please.
How do you think corporate dentistry will affect the field of dentistry in the next 10 years?
Corporate dentistry, and hear me crystal clearly, I respect however you choose to practice. Corporate dentistry has its place. The thing that I would want to know, is it a corporation that lets you strive and achieve and deliver excellent care? Or is it a corporation that puts you on a quota that says, well, it's January 30th and you're 8 crowns short, Issa. If you don't do 8 crowns in the next 2 days, you're fired. So if you are allowed to treat your patients with the finest of your care and skill and judgment, I don't have an issue if you say to me, Dr. Mark, I don't want to run a business. I don't want to hire and fire. I just want to sit down and do my dentistry. You can do that through a university. You can do that at a VA hospital. You can do that in the military. You can do it through public health. You can join a corporation. For me, I'm the one who took organic chemistry, physics, calculus, anatomy, physiology, pharmacology, histology. I don't want to be told what to do. I'm the one who did all that work. So I've earned that freedom and that judgment to say, I'm going to decide when I work, what I do, who I work with. I'm going to sculpt the practice of my dreams. So a lot of men and women that are attracted to dentistry have an independent spirit. Are the corporations going to impact? Absolutely. Some of them in a good way, some of them in a destructive way. So you owe it to yourself to do your homework before you sign a contract. At UNC, we've got 2 of our star professors that review all of the D4 students' associate contracts before they sign it.
Wow.
So we try real hard we take care of our people and they take care of us. For example, Issa, what is the finest restaurant you've eaten at?
Texas de Brazil.
I couldn't hear, I'm sorry.
Texas de Brazil. It's like an all-you-can-eat steakhouse.
Gotcha. And where is that, bud?
That's in Tampa. I'm not sure if they have it in other states, but
I think we have one in Greensboro, actually. But you go there every week, right?
oh yeah.
Do you
I mean,
go a couple?
I mean,
Do you
maybe
go a couple?
maybe once a month. Once a month.
So think about your dentistry. Do you want to serve McDonald's or Ruth's Chris, Fleming's, Morton Steakhouse? It doesn't mean one's better than the other, but one serves a $99 hamburger and the other a $20 hamburger.
Quality.
What's the difference? It's tiers of service. It's a cloth napkin versus a paper napkin. It's walking up to get your food versus being served. It's the quality of the meat. It's the quality, the ambiance, the music, the artwork on the walls. So you can build the office of your dreams. You can have a McDonald's office and see a lot of people for very inexpensive procedures. There's nothing wrong with that. I tried to sculpt our practice into being a special experience. And I saw some of the wealthiest people in the state of North Carolina and Virginia and South Carolina. And I saw men and women of extremely modest means that chose something special. So does that answer the question?
It does. Thank you.
There's not a right or wrong with it, but you have to decide, can I charge $20 and serve a McDonald's hamburger? People aren't going to pay it.
Right.
You walk into a Ruth's Chris and they hand you a 99-cent hamburger, you're going to go,
Mm-mm.
And they
No
say,
way.
but when you're done, take your plate, your dishes up to the sink. No. So you just have to decide, and you have to deliver a consistent message the whole way through.
That was
Next
a great
question, please.
explanation.
So do you have any recommendations for all of the pre-dental students in the chat that are applying pretty soon? Do you have any recommendation as to what they should be doing to make themselves a better applicant?
Yes. So I share this with you all, which is public knowledge, I believe. At UNC, I believe we had over 1,400 applicants. And I'm on the admissions committee. So send expensive gifts to Dr. Mark. No, I'm kidding. That's a joke. If I'm going through and trying to pick 250 kids to interview, how can you stand out? If you start your essay with, all my life, I wanted to be a dentist. I want to help people. That's what everybody says. You help people when you bring them a pizza. Not that that's not valuable, but you have to tell your story. So tell your own unique story. Why do you really want to be a dentist? And I would hope that you all would take quiet time and think about that seriously. The fact is, with the quality of applicants that we get, we could virtually take 600-700 of the applications and throw them up in the air and pick the first group off the floor, and we would have the best class in the country. We have the privilege of looking through really amazing kids. So how are you going to stand out? I promise you, every essay that you write, we will read it. Every recommendation, we will read it. Some people want to write the complete work of Shakespeare. Brevity is appreciated when I'm trying to read 1,000 essays, okay? If you apply to UNC, I don't know for the other schools, but we have a wide chat. Why do you want to come to UNC? And if you just say, well, I've never lived in North Carolina, it sounds like a nice idea. I appreciate that. That's not compelling to me. So if you've done your homework, if there's faculty members from UNC you follow, if you've watched YouTube videos and you see on the ACT University, there's about 8 UNC faculty members that contributed videos to that. We've got Dr. Wendy Clark, who's one of the national experts on digital dentures. Got Dr. Keith Phillips, who is a master clinician and businessman. We have Dr. Ingeborg de Kock, who is a prosthodontist and in charge of our international program. We had Dr. Ibrahim Dukum, who is one of the lead dental material scientists in the country. I'm drawing a blank on one of my colleagues who is a leader in sports dentistry. He does the dentistry for the Carolina Tar Heel football and basketball team. So just on ACT University, you could meet 6, 7, 8 of the UNC professors and get a free 1-hour lecture from them and go, this is kind of cool. So make sure your essay tells your unique story. Push yourself to do as well as you can academically. I'm not being your daddy here. Your grades are important. Your DATs are important to a point. If you start off college with a 3.9, then a 3.2, then a 2.7, then a 2.0, we're going to go, dude, what's going on, man? There has to be a reason that you've tanked here. So if you have something like that in your application, tell us why. If you start off rough, like I started off rough in college, and you go from 3.0, 3.2, 3.5, 3.9, we go, that's a good trend, you're improving. The admissions committee is very diverse and are looking very carefully to find people that are going to thrive in a wonderful environment. You all are smart. Please recognize, I believe that there are services where they give you sample essays. Is that accurate?
There are a few.
I think so, yeah.
And so when Dr. Mark has read his 500th essay that has the exact same story in it, it kind of makes me go, this doesn't look like original material. Now, for the gentlemen on the call, I'm not discriminating against you, but women have never done this. I cannot tell you how many young men have gone on the UNC Adams School of Dentistry website and cut and pasted it and say that is their reason for being at UNC. They have quoted our dean from the website. And after the 15th time I've read the exact same why, it just makes me say, you didn't even care enough to write your own story. So please be original, speak from your heart, tell your own unique story. If you have a problem with your application, say so and explain it. If you've had a personal issue, a family issue, if there was an illness in the family, if you had a relationship breakup, if you had a substance issue, everybody's had something in their life. Just tell us your honest self, and we appreciate that. We could just take the top DAT GPAs and we'd have an incredible but boring class. So we are committed to having a diverse and inclusive class, and frankly, a class that's low drama. So we, again, the kids that we have coming in for next year, we've got one more interview session left. The kids we've already accepted, it's just an outrageous class of talent and diversity and humor and music and art and athletic talent and humility and community service. So did I discourage or encourage people there?
No, I'm sure you encouraged.
And it's a great place to be.
I know exactly where I'm applying to.
Man, we'd love to look at you, bud. Promise you we'll give you a good look.
And they got you there too.
Next question, please.
Okay, so what do you wish you had known about the dental field before you had entered it?
What do I wish that I'd known about the dental field? You know, I think I was a psychology major undergraduate, and there were so many of my classmates. I started dental school 40 years ago, last August. Can you all believe I'm 62? See, that's where everyone on the call is supposed to say, Dr. Mark, you don't look 62. That's how you get into UNC. But most of my classmates were heavy basic science majors, and I was not. And when I started school, I got crushed. But I ended up doing okay. So I wish I had known the seriousness of being better prepared. I wish in my shadowing I had asked more questions, because there were a lot of basic dental precepts that and maybe shadowing was different back then. I don't remember feeling empowered to ask as many questions. But besides that, I am so grateful that I got to be a dentist. It's the greatest profession in the world. You get to make a profound difference in people's lives and care for them. And very few of them die when you're working on them. It's a lot of fun. Next question, please.
Someone is asking, is mentioning COVID in essays overwhelming? I guess they're assuming that a lot of essays in the coming years are going to be mentioning COVID as an influence.
That's a good question. We had this year's application, we had a specific COVID question, how it impacted your life. And pretty much 1,400 people put close to the exact same answer. That they were cruising along, excited about shadowing, excited about work, about research, about sports, about whatever, and their world came tumbling down, but they survived. So those essays get read, and very probably we'll have that on next year's application as well. For those of you that apply, I had a call from a prospective student yesterday who applied 2 days before the deadline. Now the ADSAS application is going to open up mid-May, I believe. Is that right? Historically, I think it was May 1st or May 15th.
May,
And
June-ish.
it
I
used
think
to
it's June
close.
for.
Now it's June. UNC,
Yeah.
we used to close October 1st. We moved it to October 15th. If you send your stuff in, it's going to take 4 to 6 weeks for ADSAS to approve it. So if you send me your stuff October 29th and then say, Dr. Mark, why didn't I get an interview? I'm like, dude,
It's too late.
you didn't show me how badly you wanted to be a Tar Heel if you mailed it in at the last minute. So it's January now. Those of you who are going to apply for next year's class, some people say, does it help to be the first applicant in, or does it help to be towards the middle? Everybody's going to get evaluated. But if I get you early on and you have a compelling essay why you want to be a Tar Heel, I'm going to remember that more than when I'm burning out towards the end after I've read my thousandth essay.
So when you're practicing, how do you decide which cases to refer out?
Question, when you're in private practice or practicing, how do you decide what cases to refer out? That's why this is called the practice of dentistry. I started some cases that bit me in the butt, but generally you're going to figure out as your continuing education improves and your judgment improves, what cases are appropriate for you to do. The worst thing to do is to do a case because you need the money. You say you don't like doing root canals and you're not good at them, but root canals you can charge a lot, so I'm going to try it anyway. That's a way to a miserable career. So because without boring you all, I had a very rough beginning to dental school, and then I finished dental school in 3.5 years. They don't let you do that anymore. I went over to Israel, to the Holy Land, and worked as a volunteer dentist for 4 months, then came back to UNC and did a 2-year hospital residency, oral medicine, hospital dentistry. So by the time I went into private practice, I had 2.5 years out of dental school. My first week in Israel, I did more work than I had done in 3.5 years at Chapel Hill. So I had already had a taste. So by doing the residency and practicing overseas, and I also did a lot of volunteer work. And I figured out pretty quickly what I really enjoyed doing and what I did not enjoy doing. So I hope that you have, by doing your homework and having role models, you'll sculpt your practice to the vision of what your preferred future is. Again, gang, I got very, very lucky that I found a segment of dentistry that I really loved doing, and I got good at it, and I hired a great team, and I had great consultants, and went to super continuing education, and my career was glorious. It just, I'm very, very humbled how things ended up. But in conclusion to that question, the worst thing that you can do is say, here's an impacted wisdom tooth and I need the money, so I'm going to try it. I took some chances. There's nothing wrong with stretching professionally, but it's sure better to do continuing education before you take that chance. It's another opportunity to have a partner, an associateship, where you can get bailed out if you make a mistake, if you get started going down a road and you get lost.
Dr. Hyman, I think that's all the time we have, but I really want to quickly thank you for your honesty in such an informative presentation. It was an honor having you, honestly.
Issa, thank you so much. A pleasure meeting you. Alexis, thank you for these questions, for this organization. I love doing this. If I can help you all with anything, you've got my cell phone, my email, my website. I just wish you all an absolutely glorious, happy dental career. And if I can help answer a question in any fashion, reach out to me. You all stay safe and protect yourselves, and good luck to you, okay?
Thank you. And thank you everyone for joining. The quiz can be found in our YouTube chat, and it can also be found in our link tree. We also have a session tomorrow, so please, if you're able to, please join us. And I hope everyone has a great night.